I guess I'm the type of person that if I'm going to do something, I really want to do it well. So in that sense, for me to do things well, I think structured learning and is a must.
Hey guys, welcome to the CPD Junkie podcast, where we bring you interviews with dentists sharing their CPD stories and journeys from around Australia. Greetings CPD Junkie podcast fam, I'm your host Laurence Doan, and today we're joined by Dr Ian Zhou. He is a 2019 Griffith graduate working full-time private practice in Brisbane. He has a keen interest in both restorative dentistry as well as preventative dentistry. Dr Ian Zhou, welcome to the show.
Hi, Lauren. Thank you for having me. Nice to finally meet you.
Yeah. So before we kind of get into it, how's the Brisbane flooding affected you?
Look, flooding is pretty bad over here, but I'm quite lucky in the sense that I haven't got affected personally. But certainly, when you have a look around, you can see all the damage. I live pretty close to the Brisbane River, so I can see the river over flooding, and then seeing things on the news, as well as road closures on the way to work and to home. I'm sure it's pretty devastating for a lot of people up here, to be honest. So things will get better very soon.
You guys didn't lose power or anything like that, did you?
No, but our clinic did shut down on that Monday because of the severe weather. We didn't want patients to risk driving around in that weather, so we didn't actually have any patients on that day. Internet did cut out a little bit here and there in the area that I work with, but overall it wasn't too bad.
Is it a massive cleanup at the moment, or it's kind of okay?
Yeah, definitely. The cleanup is still ongoing. I know some people's clinic did get flooded, and from some of the images I've seen, as I said, it's pretty sad. But yeah, cleanup is still ongoing for sure, and hopefully we won't get a second round of rain. But the weather report says something different, so only time will tell, I suppose.
Yeah, fingers crossed. All right, let's dive straight into your CPD dental journey. So you graduated. What'd you do? What did you think you were going to do? Did you end up doing that? What happened?
So even prior to graduation, I guess I sort of had an idea of what I wanted to focus on once I graduated. So my first ever CPD after graduation was a communication course by PrimeSpeak. So I enrolled myself in that course just before I finished uni, because there was a deal going on saying that if you register as a uni student, you're going to get a discount. And I knew communication was an important aspect of dentistry, especially in private practice. So I knew, and PrimeSpeak, it was well known in that communication field. So I knew I couldn't really go wrong with signing up for, PrimeSpeak, which I'm glad I did, because after attending PrimeSpeak, it really, really, I guess, taught me a lot in terms of communication. Because personally, I went into dentistry as a high school leaver with not much work experience, etc., etc. So, going to the private practice, telling patients they need treatments, worth thousands of dollars. This idea is new and foreign to me, and it wasn't until PrimeSpeak that I really had a firm grasp of the concept of communication and how different people will approach it with different type of patients, etc., etc. So I'm really, really glad I did that course, and it helped me immensely from that point onwards.
Yeah, I mean, I too signed up for the PrimeSpeak when I was a student, when I was graduating as well, because to your point, they had a good deal. And I was like, just to your point, everyone else is talking about it. I got to go attend and find out what it's all about. So you did the communication course. Okay, so now you're bringing it back to the clinic. And so what happens from there? Are you diving into more clinical stuff that you want to dive into, or?
Yeah, when I started private practice, I actually started at a single chair clinic. So I was by myself most of the time, which wasn't ideal, but that did teach me a lot of things. But yeah, so after communication, I sort of started really want to focus on just the bread and butter stuff. Um, Restorative being one of the main things that I was keen to just do well in, just really, really get the basics down and then learn how to do restorative properly. Because at the time, you see a lot of stuff on social media, and then you look at your own work, you'd be like, that's not right. Like my one doesn't look anywhere near, as good as the ones that you see on social media. And then you'd be like, what am I doing wrong here? Restorative has always been one of my main, I guess, area that I've focused in. And that's that's when I guess I did a really, really basic and simple restorative course with Dr. Michael Mandikos up in Brisbane, where he covered some really, really just like simple basic stuff, gave a lot of ground knowledge and foundation to build up on. So that's where I really started my restorative journey. But things didn't really, I guess, change a lot until I discovered biomimetic dentistry on social media. That's when my approach to restorative changed a lot. Like learning how to bond properly and learning how to reconstruct the tooth close to the original biomechanics of a natural tooth. So that was the big turning point in terms of my restorative journey so far, and haven't looked back since.
Yeah, well, let's dive into it a little bit more. So you're in a single chair practice and you're trying to work on this bread and butter stuff. You're only looking on social media and you're seeing like, my restoration is not as good, but like you have no one else to lean on. Like, how do you go to for advice? Who are you talking to? Like, what's happening?
Yeah, you're right. So that was certainly a struggle because just looking around me, I guess these other dentists that I know, they didn't really practice the type of dentistry that I wanted to do. So, it wasn't really helpful in terms of asking them, how do I do this type of dentistry to get this type of result? Because, that's not, the dentistry that they were doing. So I in fact actually went back on social media and then reached out to a lot of people that were posting these type of work, and then just wondering, how did they get there, and asked for advice, possible CPD courses, and then just learned a lot more. And thank you to all those people on social media that's actually helped me over the last couple of years, because they're really made a big difference in terms of the way I practice. So yes, coming back to answering your question, I didn't actually get a lot of like personal mentoring like in the clinic, but I did enroll into a couple of courses online that had really good reviews from the people that I've reached out to. The one that one of them was a rubber dam course by Dr. Kalen Pop. I'm sure you've heard of him. He's well known as the rubber dam master. So I did that rubber dam course, and then later, after COVID went away, I did Sahil Sony's rubber dam course. Just wanted to like reinforce the things I learned in person, and then in terms of doing like more biomimetic dentistry, I I discovered Stephen Shivnhouse on Instagram, and he had a institute, the BARD Institute, which stands for Biomimetic and Advanced Adhesive Restorative Dentistry. So I enrolled in that course. So I actually did a lot of my learning online. Especially with COVID and everything, Queensland borders, as you knew it back then, for the last 2 years, was mainly shut. So I couldn't really go to in Sydney or Melbourne for a lot of the hands-on courses. So a lot of learning was just online, to be honest.
Mm-hmm.
Yeah.
Yeah, I guess like we had to make the most of what we could, right? And interestingly
Yes.
enough, some people probably chose to take a break, but you decided that, I'm going to sign up for something online and then learn it through a structured way. So, I mean, biomimetics is kind of, still kind of very new, but it's like the hot topic that everyone terms right now. Because
Yeah.
there are a lot more people now promoting around it, right? And
Yes.
so, what's your thoughts on it, having gone through it now?
Um. Again, I the way I see it is that some people think that you go on, but you do biomedic dentistry, therefore you don't cut crowns, or you don't do retention, or resistant form, etc., etc. How I really see it is I just see it as an additional tool in my toolkit, because I don't I still do crowns, not as much as I used to, but I still do crowns. There are certainly cases and times where I think crowns are they have their benefits. So yeah, I don't really see oh, you have to do this, you have to do this. There's no right or wrong. It's just that having additional tools in your toolkit is always handy when you have situations where one method would work better than the other. So that's how I really see it. But I think certainly even when you are doing traditional retention and resistance forms, I still think bonding is quite important. Yes, again, there's no 100%. You can't go 100% bonding for everything. Yes, there are cases where you do verti preps and then you do cement and then you rely on retention features, but bonding does become a big part of my restorative practice after I've started biomimetic dentistry.
Yeah. Ian, look, I'm just gonna say it here. Some people are gonna listen in, and you're 2 years out. They're gonna be like, I'm an associate. I want to do biomimetics, but there are so many things I need to get as an associate. How do I get these tools?
Yeah, I agree. I had the same problem when I first started. I guess because when you do biomedic dentistry, yes, I guess tools as well as the bond primer or whatever you use, it's quite important because we all promote gold standard bonding adhesive protocols. And then you come in to look at using rubber dam, using air abrasion or sandblasting units. Yes, things adds up. When I started, I didn't have everything. And as an associate, I did have to, I guess, work my way to my boss. Saying a way to my boss that does make him think that investing those tools I need will benefit the clinic as well as the patients, because it was getting to the point where I guess when you do adhesive dentistry, air abrasion unit is so critical, and I just had to essentially twist my boss arms a little bit to get it actually, because as you know, it's not cheap to get one of those units.
That's right. That's right. You'd be like, I see plaque everywhere. I need to get rid of it.
Yeah,
Just triplex blowing won't do.
and rubber dam, even rubber dam is not cheap. If you want to use the good isodam stuff that, really makes the procedure a lot easier, because most people don't use rubber dam because they think it's time consuming. So rubber dam rips, it breaks, doesn't fit, etc., etc. If you really use, the good rubber dam like isodam, I've found a lot of those issues don't really exist. But coming back, yes, isodam is expensive. Some owners don't want to use that because if you use it a lot, you do go through boxes and boxes.
Yeah. So, I mean, to your point, I mean, talking about rubber dams, you did 2 courses on rubber dams. People would be like, I learned that in uni. Like, why do I need to do 2 rubber dam courses?
Yes.
Just graduating, by the way. Like, that's what people will say.
Yeah. I think I've always liked using rubber dam. Even back in uni, I was a big fan of rubber dam. And with the rubber dams in uni, I'm not too sure what sort of rubber dams people would get in unis, but back in my days at my uni, the rubber dams I used were not the best stuff. Didn't look good. The handling property wasn't good. It teared and ripped very easily. So yes, I used rubber dam in uni, but I didn't really have a enjoyable experience. So coming out of uni, start using proper rubber dam, and that's when things actually got better for me, because I was like, wow, things are so much easier to use when they're good. So
when you got the right tools.
Yeah, I really sort of enjoyed start using rubber dam, but the things that you learn in uni, some things, yes, you can isolate with the type of rubber dam that you were given, but some things you just can't isolate easily with the type of rubber dam you're given. So you don't really perform a lot of, like you do simple isolations, but you don't tend to isolate teeth that are very difficult. For example, I never learned how to do bond crowns under rubber dam, these sort of things. No, you don't really learn in uni. And these sort of things are really applicable in private practice after graduation. So learning how to, just as simple as a floss tie, to learning how to select rubber dam clamps. There's so many clamps out there, and having one over another will make your life so much better. For example, when you're working on the most posterior tooth and you're doing a class 2, rubber dam clamps, the wings always gets in the way. You can't pop the sectional ring on. You can't seat the matrix fall you down. All these things will happen because in uni you learned how to use most rubber dam had wings, had those little wings were easier to replace. But after graduation, I learned there were wingless rubber dams and when to use them, when not to use them. So rubber dam honestly is a huge topic on its own, and it does play in the sense that if you want to do proper adhesive dentistry, rubber dam is really, really important in the sense that it is a predictable way of isolating teeth. I'm not saying you have to use rubber dam to isolate teeth, but it is a very, very predictable way of doing it, and it is referred as the gold standard in terms of isolation.
So you've got this biomimetic down to a degree that you're comfortable with, right? But dentistry is not all that. So are you diving into other things as well?
Certainly. So once I sort of got a hold of essentially the restorative part, I came to this cross path this, I guess, many graduates will face. So at the time, I was thinking, time to do, a big investment. I want to learn things properly. I don't want to just go to weekend courses or webinars or online courses. I want to do a structured learning. At the time, three main topics. Okay, so I wanted to do I want to do the mastership offered by the biomedic mastership offered by the elements in America. So that's a proper structured learning about biomedic dentistry and restorative adhesive dentistry. So that was a potential course that I was going to sign up for. The second one was, as most graduates would want to do, ortho. Okay, I looked into a lot of ortho courses, the big ones, and then also, of course, implants. So those were the three main areas where I had to sort of pick and choose, do a bit of research, come up with, what sort of options in terms of structured learning I do have for these three areas, and which area do I want to dive in first? Because at the time, just like a lot of graduates, I was working 6 days a week. Time wasn't on my side, so I definitely knew that I couldn't take on multiple areas at once. So I just wanted to focus on one area and then finish that and then jump into another area. So, the other thing that really helped me to make that decision at the time was that at the time that's when the time where I started a new job at a clinic where the boss does both implants and orthodontics. So I knew that was the best time for me to start something, because I had support person, with me there. And my boss recommended that, ortho is a big topic, and it's a topic that you want to start early, because once you settle down, have a family, etc., life gets in the way. Learning such a huge big topic becomes more and more difficult. So I took the advice, didn't think twice, and signed myself up for a progressive seminar, POS. He made the choice easy because he was trained by POS. I didn't want to do something completely different to him, and therefore makes the mentoring a bit more difficult for him. So I made the choice of going with the same program that he went through, years and years ago. So yeah, so I'm now 6 months into the program of POS, and yeah, loving it. Started a couple ortho cases here and there. So yeah, loving it so far.
Yeah, so to your point, like you didn't feel comfortable trying to take on implants or ortho yet until you were in a situation where you had that mentoring and that support to get started. I want to come back to that point about, you were deciding between biomedics, ortho, implants. Like I talk about this in our podcast, but why do you think people in your situation feel compelled to want to learn these things so quickly?
I certainly think that social media has a role to play, in the sense that you see all these sort of work and you want to do that sort of work. And when you look at how they did it, you always come across implant, ortho, clear aligners, or just moving teeth, as a part of all their treatment plan. So yes, if you don't know how to do implant and ortho, you really sort of limit yourself in terms of treatment planning. Because ever since I've started ortho, I've actually learned what to look for, just in terms of referring. I just started ortho. I don't do a lot of complex cases. I do very, very simple cases. So I actually refer a lot of ortho out. But, doing these sort of cases will actually help you in terms of treatment planning, just to things to look for. Because, just put it simply, I just don't think dental schools teaches us enough for us to be doing complex type of treatment planning, which is, I think, one of the hardest aspects of the history, to be honest. So yes, people like myself who graduate and then wants to ortho and implant, because I just think, from my personal view, I just think that what graduates want to do a lot of the things that they see, and most of the things that they see nowadays are on social media. So when they see these type of things, they're always looking to more, oh, how do they do it, you know? And then ortho and implant becomes sort of a roadblock for graduates like myself. So yeah, I think that's when I sort of think I got to start tackling these roadblocks. You know, as big and as difficult as they're seem, you know, if I don't start, you know, they're just going to be there and roadblocking me, you know, for the rest of my career, which I don't.
I mean, look, some people are going to be like, in your second year out, you know, I've got a huge I've got a huge thick debt, right? I just paid for dental school. Now you're telling me that I have to potentially think about something structured that's going to be like 20K a year. Like, what is going on, you know? Can you try to explain it to some of these people that might be trying to figure out, you know, if I should dive into something like that, or if I'm just more comfortable doing weekend courses? Like, why did you make the switch? Like, you know?
I guess I'm the type of person if I'm going to do something, I really want to do it well. So in that sense, for me to do things well, I think structured learning is a must. In fact, I have been to weekend courses when I was deciding between the biomimicry and ortho and implant. I went to a weekend implant course in Brisbane, and it was just an introduction course. I went there just to see, you know, what implant dentistry actually, you know, is, and what type of treatment they offer, etc., etc. And yes, it was good, but not good enough for me to think that, oh, I'm confident enough to place implants. So I think for me to get that type of confidence, for me to start treatment, I really need to have some form of structured learning to back me up, you know. So that wasn't a question whether I should pick over weekend courses or big 20 grand 2-year long courses. It was always going to be, you know, doesn't matter, regardless of the time or the money. If I really want to do something, I was gonna do it well. I was gonna give it everything and try my best, certainly. So yeah, I guess. Yeah.
I mean, you said you were contemplating about implants as well, but like, how were you trying to? You mentioned for ortho that in choosing the ortho courses, you kind of picked the one that your boss or mentor was doing, so it kind of made sense. But you know, for those other things that you were mentioning, how are you trying to navigate deciding between what to pick? Because there's so many different CPDs out there.
There are so many. So when I was picking, or my selection criteria for when I was looking at implant courses at the time, was that it had to have hands-on component and preferably like real patients. So it's just that personally, I think dentistry is just such a hands-on type of profession that it's almost impossible for you to learn it through the books, or, you know, just through theoretical. So hands-on was always a must, and live patients, doing actual implants on live patients was the thing that I was looking for. So, you know, this was a while ago when I was looking to it, but in terms of implant courses at the time, I think I was really, really, really keen on signing up for ARIA Dental for the implant course. That really had a lot of things that I was looking for. So that's still probably the course I'm going to do after I do finish ortho. So who knows? Things might change back, you know, in another year or two, but at the moment, that's still another course that's on my list that I want to do to learn implant.
So talking about, the future, have you contemplating whether practice ownership, specializing, or just remaining like a super GP? What's your thoughts?
Specializing, no. I I think I'll get too bored, and to be completely honest, I'm not I probably don't want to go back to uni. So specializing, probably no. But practice ownership, I haven't really considered too much. At the moment, I'm just trying to learn, like like know what I want to do and get good at it. And then, yes, my boss is really kind in the sense that he actually, try to share a lot of things, just the his point of view from a practice ownership point of view, how he look at business and et cetera, et cetera. So I'm really thankful for it, because I do pick up things here and there, which, who knows, might come in handy one day. But practice ownership is probably not on the top of my mind at the moment, because I think there's still just so much I want to learn before I want to introduce the headache of owning a practice.
I think it's nice that your boss is open to, talking about his point of view, because a lot of associates, they'll be like, I want to get something, and the boss will be like, no. Or they'll be like, oh, there's just no reason, there's no explanation, you just can't understand, and it hinders the relationship. You'll be like, you just don't understand. It's like, come on, like, we're all in the same kind of boat, like, let's talk it out, But that's kind of cool to hear.
Yeah. I definitely think I'm quite lucky in the position I am with my current boss, with how understanding he is when I do ask for materials or tools, et cetera, et cetera. He's quite supportive.
In this short space of being a dentist so far, has there been any particular CPD that you felt like you just wasn't as beneficial for you?
No, not really. To be completely honest, I don't think I've attended a lot of CPD compared to some of my peers. But like, whenever I do sign up for a CPD, I do tend to do a bit of research on it, and speak to people who's done it, or possibly looking at reviews, on DPR, etc., etc. A lot of people are posting, reviews of different courses on DPR, which I find really helpful. So no, I don't think I've gone to a CPD where I'd be like, oh, this is, I didn't really get much out of it. I tend to pick my CPD a bit more carefully.
Yeah. So you've dropped a few names here, but has there been anyone in particular who's been pivotal in your career path, and why?
I have to come back to the day where I discovered Stephen Shivenhouse on Instagram. He has been, well, like, his course, as well as what he's posts on social media, has helped me a lot, and as I mentioned before, really changed my restorative protocol, as well as like treatment planning, etc., etc. So he's definitely one of the person that's impacted my the way I practice restorative dentistry, like, dramatically. In terms of the people that I've actually met in person, I think my current boss is a person where I look up to. He, after I graduated, a lot of my friends, my girlfriend, they tell me, oh, Ian, all you look at is teeth. You go on Facebook, Instagram, it's all teeth. You go on computer, you're looking at your photos of teeth, it's all teeth. So you're obsessed. But putting short, I thought, oh, maybe they're right. Maybe I'm a little bit obsessed. But when I met my boss and when I got to know him and the amount of work and learning he's obsessed. Like I'm not even, I shouldn't be called obsessed with dentistry, when I'm compared to him. He's really passionate about dentistry. So he's another person that I look up to a lot. And I'm really, really grateful that he's sharing and mentoring me clinically in the practice, helping me. So my boss is definitely someone that I look up to a lot and someone I rely on a lot day to day.
Yeah, look, Ian, you're not alone in this boat. I'll admit, my partner looked at my phone and was like, why is all your Instagram just teeth? Like, why are you just looking at teeth all the time? I'd just be waking up in bed just scrolling through, through dental profiles, and they'll just be like, what are you doing? You are obsessed. So don't feel alone, okay? Don't feel alone. But to your point, yes?
What is your girlfriend's not in the dental industry, I'm assuming.
That's right, she's not. So they can't relate.
No. So like, I come back from work, and then I got I go on the couch and then go on social media and it's all teeth again. My girlfriend like, we were looking at teeth all day. Like, what teeth when you come back?
You know what? Like, that's a sign of there's passion. You want to be passionate in what you're doing. You want to know that your dentist. I mean, like, that you would assume your patient wants to know that your dentist is passionate about teeth. But the other point is you have a mentor, like you said, who's super passionate about dentistry. I find that that's definitely a key element to have in your mentor, because that kind of infectious feeds onto you. And then when you can openly talk about things and they just kind of bounce off ideas and you just bounce off each other, that's like next level. When I talk to other people and they're just not as keen about it, and it just reaches a dead end, and you're passionate about it, it's a whole different when you're trying to learn and you're just trying to get out there.
It certainly is. And coming back to the question you asked previously, when your boss is that passionate, and when you ask for, oh, can I get some rubber dam? Can I get some clamps? Can I get that? The conversation is certainly a lot easier.
Yeah. And then like, you're showing that interest because you're attending it, you're applying it, like, it makes sense. You just be like, look, I'm going to burn through all these bad rubber dams and take me a long time, or I'm going to use this really good rubber dam, and it's going to be worth it. The experience is going to be a lot more enjoyable. The staff's going to find it a lot better. I'm going to find it less stressful. Like, it just all adds up.
Exactly right.
Yeah. So, I mean, you went from a situation where you're in a single chair, didn't quite have that kind of mentoring, to finding another practice that had mentoring. Talk to me about the struggles that you may have experienced during that time, and what you came to realize, because I think when I got to know you early on, you were like, I could probably do this. If I'm in a single chair, I'll probably learn a heaps. But
certainly, in a single chair, it was very, very, very different. So yeah, I guess when I started, I was really, really nervous to do anything that I haven't done in dental school by myself. That was a huge challenge. At the time, I think in dental school, I didn't take out any upper wisdom teeth, and I had a case, I was like, oh my God, I'm so nervous. The wisdom tooth, it must be so difficult. I just had no idea. So I was stressing out just taking out an upper wisdom tooth, and I even asked one of the dentists to come in on a Saturday with me just in case I couldn't take this upper wisdom tooth out, and that dentist, thankfully was nice enough to put up with my craziness, and then came in, took the time and came in on Saturday, and then watched me took out the tooth in about a minute or less than that. So yes, working a single chair as a new grad was very, very daunting when I had to do procedures that I've never done. Um, and extractions. That was, if for any graduates that really want to, or have to work at a one chair clinic, be confident with extractions, because that can be the the key difference in terms of whether you could make it or whether you're going to just lose it. Because just being there by yourself and not being able to get a truth out that you've started is very, very, very stressful. So yeah, I learned that the hard way. Learned how to extract difficult teeth the hard way. So I guess in a way I did learn in the end, but I definitely learned it through the hard way.
Yeah, because like I asked that question because there will be graduates that will come out and they're like, I'm keen, I'm just passionate, I just want to get out there and do stuff. And then, of the offers that they get this opportunity to be like, oh, I've got this chair, let's just dive into it. But I was hoping you could share your experience with it.
I guess there's not, let's just say there wasn't a lot of, I guess, positive experience to share at the time. But looking back, you always think that, I did learn a lot of stuff, but just the hard way, through a lot of stress and patient management, etc. But my advice, I guess, would be that because they're different type of people. I know people that are just confident naturally. They learn, I don't know, they do a 1-day course and they're very confident. And I'm not saying that the confidence is wrong or false, but they're just confident people. So yes, in dentistry, there's always going to be the first time, whether you have someone there holding your hand or whether you do it on your own. There's always going to be a first time, and the first time is not going to be easy. If you're confident, yes, certainly helps. But if you think that you're the type of people that's a bit more, I guess, conservative, not willing to step outside your comfort zone and push your limits. So for example, in dental school, if you weren't very confident with your diagnosis, your preps, you had to get your tutors check a lot, even towards, just before graduating. I would try to stay away from, one chair clinics. For the people that are really, really confident, at what they've learned and what they do, sure, I think there's definitely things that you can get out of a single chair clinic where you're going to learn a lot of things. But personally, I wasn't the type where I'm like all confident and but jumping the deep end by myself, etc. So
but you didn't know that prior, but after having gone through it, that's how you feel.
Yeah, that's right. So yeah, that's right. Retrospectively, yeah, I don't think that was the best start that I could have given myself. But again, as I keep going back to, I've learned a lot.
Yeah. I mean, we've all been through, everyone's got their own first years of, it's a steep learning curve when you graduate, even for me, when I first graduated as well, in a situation you might be out of practice, but it's that long weekend, that Friday 13th, and the boss has decided, you know what, I'm taking that break. Lawrence, do you want to take on that weekend? And I'm like, okay, not knowing that that's the week where people come in with toothaches because everyone else is either closed, and then to come in, and to your point, you're in that situation, you have to do an extraction. What do you do? The specialist's not on call. No one's going to be able to bail you out straight away. It's not a nice situation to be in. And I hope for people listening, and if they're a new graduate or recent graduate, definitely don't put yourself in that situation. Yeah.
There's less stressful way of learning, than that.
Yeah. So What's your ideal clinical day look like now, and the type of procedures you might be getting up to?
Um, my ideal clinical day, a mix of everything. The only area of dentistry that I would try to stay clear of is probably molar endo. I think that's an area where I just don't have the interest nor the patience to get better. So I've essentially given up in that sort of area. So in an ideal day, no molar endo. That's very, very helpful. And just mix it up. I like to mix things up. I sometimes I don't even like doing two crown preps back to back. After crown prep, I'll probably want to do a bit of cleaning, and then some fillings, and then maybe some ortho, changing wire bands or ortho consult. Uh, I do dabble a little bit in the wisdom teeth, surgical wisdom teeth extraction. But yeah, a bit of emergency here and there. But yeah, that's how I like it. Break it up a little bit, because when I usually have days where it's like crown prep, crown prep, crown prep, and then another day is like filling, 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 filling. Another day is like clean, 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 clean. At the end of the day, you're just so, number one, you get bored. Number two, you feel so drained. You feel like the day is so much longer. So yeah, I like my days to have a bit of everything, to be honest.
Yeah, I guess it's because you're spending so much concentration in trying to do these bigger tasks. You just need your mind break.
That's right.
Yeah.
That's right. I agree. Yeah.
So share us what you hope your ideal clinical day or non-clinical day might look like in 5 years' time. Because off the record, we were talking about how we're doing 6 days, and now we're kind of reaching that balance where you wanted to be at. So, and what kind of CPD do you want to kind of do to get to that point?
Certainly I want to, or hopefully in about 5 years' time, I would be a lot more confident about ortho. Therefore, I would take on a lot more ortho cases, referring less cases out, and then on that, I hope to keep doing restorative dentistry, the way I have been doing, and then hopefully do a bit of simple implants, and oral surgery. As I said, I like to mix things up. So I know I've said quite a few areas there, but yeah, I just want to do a bit of everything, to be honest.
And on your non-clinical days?
Non-clinical days, I always try to exercise as much as I can, because coming back to health is your number one wealth. So I really try to look after my health. So on my day off, hopefully in about 5 years' time, I won't be studying as much as I am at the moment.
Don't worry, the studying never stops.
But yeah, as I was going to say, yeah, I don't think the studying will stop. But hopefully I'll get a bit more time to do more sports, more exercise, and then hopefully in 5 years' time I'll start my family, and then have plenty of time for my family, hopefully.
Yeah. So quick question, you're originally from Sydney. Are you planning on moving back anytime soon?
No plans of yet. If anything, probably planning on staying in Brisbane for the foreseeable future. Yeah, so no plans on going back to Sydney anytime soon, just yet.
All right. Well, Dr. Ian Zhou, thank you for coming on the show today. If you could let the people know how they can find you or what you've got going on in your life.
Well, I have two, pretty simple. I just do some posts on my social media, mainly Instagram. It's dr.ianzhou. So yeah, if you guys want to check it out and have a look to see if there's anything that you can hopefully get learn or get from my post, that'll be great.
No worries. For our viewers, if you like this episode, drop a comment below on your favorite part, but don't forget to like and subscribe, and we'll see you in the next episode of CPD Junkie Podcast. Thank you.
Thank you, Lawrence.